With more than 1 million pieces of Count the Kicks educational materials in doctors' offices, birthing hospitals, and clinics nationwide, more than 80,000 women downloading the free Count the Kicks app to track their baby's movements, 50 baby save stories headlining the Count the Kicks website, and with countless more save stories in homes all across the globe, this evidence-based public health campaign is reaching more expectant parents than ever before.
This research is not just sitting on a shelf, it's saving lives in Iowa and across the United States and even across the globe. And, you know, science is exciting and so meaningful.
It's a campaign created by 5 women to honor 5 daughters they never had the chance to know.
We heard from a researcher in Washington, D.C. About the Count the Kicks program. It wasn't called Count the Kicks in Norway. And we got on that plane and we just looked at each other instantly. We both said, if they can do it there in Norway, why can't we do it in the United States?
On a Southwest Airlines napkin, on a flight back to the Midwest, the women mapped out their plan to save babies.
This should be something that should be part of your pregnancy health care. It's Count the Kicks, 28 weeks, track your baby's movements.
There never had been an organized effort, not even the American College of OBGYN. No organization had put forth an organized effort to educate women. This was completely new. We, as I said, we as physicians, as clinicians, we knew the importance of it, but, and we would occasionally talk to our patients about it, but not on a real consistent basis. I hate to say it, but we weren't. So they not only educated patients and women, but they also educated clinicians.
These materials are now in living rooms and bedrooms across America and across the globe. And it stemmed from people saying, yes, we'll get involved and we'll help you.
People like John and Mike Schreurs of Strategic America. Their ad agency played a key role in the birth of Count the Kicks, creating the mom-centered educational bright brochures.
We just wanted to lean into the opportunity, possibility to help her.
The story, the passion, the purpose, how can you not get behind it?
To hear them say, all we want to do is save one baby. So we said, okay. We obviously knew we could do more than that. We believed in their story and their mission and their passion.
I will never forget the very first baby save that we got.
Hi, my name is Danny. I'm the first baby to ever be saved by Count the Kicks.
I remember just sitting there, my mouth open. I think my eyes were as white as saucers, and I thought, boy, those little girls did it. They did it. We wanted to save just one baby, and it didn't take very long. And it just seemed like we knew, I feel like then I knew we were really doing the right thing, and I knew in my heart there would be more.
I'm Hayden, and Count the Kicks saved me in 2010.
Count the Kicks in 2015 saved me.
Count the Kicks saved our baby in 2017.
Knowing that your loss had saved one baby, and that's what we said from the beginning. If we could save one baby, it would be worth it. And when we had that first baby, that one baby, and then the prospect of having more, yeah, just incredible.
In the first 5 years of Count the Kicks in Iowa, the state's stillbirth rate dropped nearly 29%, and Iowa has maintained a reduced rate ever since, translating to hundreds fewer stillbirths over the years.
I just look at him and I can't imagine, you know, had I not called that day and, you know, things could be so different.
Count the Kicks is super meaningful to our family because we have an alive and thriving little girl that we might not have had if I didn't know about Count the Kicks. So I just thank the founder so much for turning their loss into action and for doing all the work that they do. We just can't say thank you enough.
Definitely to pay attention to Count the Kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here.
It makes me smile when we see Well, when I see a baby saved, like I go, oh my gosh, and I look up and I say, thank you. It's a good feeling.
Every baby that comes back saved, we look into those eyes and we see our girls. That is an honor and a privilege that I can't ever imagine having without these women and Healthy Birthday and Count the Kicks.
Every time this happens in our hospital, it just brings me back to just that whole idea of 5 strong women turning their grief into saving lives. It's pretty impressive.
But their work is not over. According to the CDC, we still lose 24,000 babies to stillbirth every year in the United States. And a racial disparity persists too. 1 in 94 African American women will lose her baby to stillbirth, twice the rate of white women. The team behind Count the Kicks, including 22 ambassadors across the United States, finds this unacceptable and is working to make stillbirth for all moms a public health tragedy of the past.
We have new women getting pregnant all the time, and they need the same education, they need the same information that the women before them needed. So it's always going to be a need.
It all started with five moms who had gone through a very tough experience, getting together and coming up with something that I think that's really helped in our entire state as we move forward. So I just first of all want to salute everybody that's been involved with the Count the Kicks initiative and just commend you on the great work that you've already done.
I think it's just starting to accomplish what it's meant to accomplish. The beautiful thing about this is that, yeah, it can work in the states and the regions and the cities and the areas that are familiar with it. It can go international, it can go global. And when it does that, who knows how many children are going to be saved.